Good afternoon, everyone, and welcome to the Black Health Trust weekly broadcast. My name is Dr. Ivan Walks, and as always, I'm joined today by my co-moderators, Dr. Barbara Nabrit-Stevens and Dr. Randall Maxey. We have a guest speaker today, Dr. Jerry Abrams, who will be joining us a little bit later. And with that, welcome. We're glad you're back with us today. And I'd like to turn it over to Dr. Maxey to say good afternoon.
Good afternoon. I know you're challenging me. It still feels like morning here, Dr. Ivan Walks. Thank you, Dr. Barbara Nabrit-Stevens, for being with us, and Mr. Simon Cooper and Ms. Shakini Stevens, and our guest, Dr. Jerry Abrams. There have been a lot of questions over the past few days since we had our last session on Sunday. I've had a lot of patients coming to me asking what they should do. The majority of them, I would say, are unvaccinated and recently tested positive for COVID after presenting with symptoms of nausea, vomiting, brain fog, lack of taste, shortness of breath, and they still had a lot of concerns about why they should have gotten vaccinated and even what they should do. So we hope that we can review some of the material that we had in past weeks to help people to understand why the vaccine is so important and what other treatments are out there. So we're going to be open for questions from the listening audience, as well as we're going to ask questions of each other. And then we're going to have Dr. Jerry Abrams, who's high energy, and he's out giving a vaccine drive as we speak. So why don't we get started? And please chime in if you have questions. Dr. Walks, if you would proceed.
Yes, sir. Happy to do so. I'm going to give everyone the COVID-19 tracker numbers. These are the CDC numbers as of yesterday at 8 p.m. And if you remember the numbers we've given previously, things are going in the wrong direction. Total US cases, 37,583,545. Total new daily cases. This is where a lot of our concern is, 157,450. Total US deaths continues to rise, 625,375. Total US daily deaths, 1,120 just in one day. Total vaccine doses, 361,684,564. So a lot's going on. Things are headed in the wrong direction. Dr. Nabrit-Stevens, can you take us further down the road?
It would be my pleasure. And I will like to admit that the next slide that we're going to look at, I created as a response to statements made by the Lieutenant Governor of Texas. And one of the things that we at Black Health Trust hope to be able to give you is not only accurate information, but information that you may need to deal with different circumstances. And I did notice a question in the chat that we are going to come back to, because that's the kind of question that you need to be able to deal with. And so we will definitely go over that question. So the statement was made that the reason that the COVID-19 surge was occurring there in Texas was because of unvaccinated African Americans. And I said to myself, we need to review the stats so that we can be able to appropriately answer those kinds of comments. So what I did was I took the data from the CDC as of yesterday, with the first column being race and ethnicity, the second column, the percent of cases attributed to those races and ethnicities, percent of deaths, and the percent of the fully vaccinated in those categories. Now, remember the caveat that this is not the sum total of those that Dr. Walks just gave us on the previous slide, because unfortunately, all states and jurisdictions do not report racial and ethnic data. So this is of the data that the CDC is able to tap into. So, and I also attempted to put them in descending order of numbers. So the white non-Hispanic category accounts for 50% of all cases, almost 59% of all deaths, and 59% of all fully vaccinated individuals in the United States. The next category, the next highest category is Hispanic Latino. They have attributed to them 28% of all cases, 18% of all deaths, and are currently at 15% fully vaccinated. Black non-Hispanic come in third at 13.9% of all cases. Let me remind you, based on the most recent census data, we account for 14% of all of the population of the United States. So that's not good. We account for 12% of all the deaths and only 9.2% of all fully vaccinated. The other racial and ethnic categories make up the rest and are far below the first three. So here's the information. When people are making statements, you need to be able to check them when they're giving out, I should say, misinformation. So this is the situation as of yesterday for us in the United States. We have a lot of work to do in terms of getting our vaccinated individuals up, and we are still having way too many deaths. The rest of this program is going to be addressing how you can prevent infection, how you can treat infection, and how you can protect yourselves. Please, we welcome your questions because we want to equip you with the information that you need in order to take care of you and your family. Thank you.
So Dr. Naybert-Stephens, before you leave this data, I just want to ask a clarifying question to make sure I'm following you. So when someone says that the reason for the surge is because African Americans are not getting vaccinated, we can know that absolutely more African Americans need to be vaccinated, and we want to spread that message. At the same time, it is true that African Americans, based on the percentage of cases and deaths, are not what's driving the surge. Unvaccinated African Americans are not what's driving the overall surge in the country. Is that fair to say?
That is correct, because there are far more individuals of other racial and ethnic categories that are unvaccinated.
Thank you.
All right, I think we can now move on to the next slides. I was asked to go over again some of the information that I presented last week, and I'm happy to do that. Again, I have heard some comments made that I think are misinformation. I heard a couple of different interviews where it was stated that monoclonal antibody therapy was hard to get. And I want to make sure we are clear about what it is and when we need it and how to get it. So we're going to again look at that little cartoon because I think it really gives a pretty good idea of what monoclonal antibody therapy is.
COVID-19 monoclonal antibody therapy. Have you recently tested positive for COVID-19? Are you worried about your recovery because you were in a high-risk health group? To find out if you are in a high-risk health group, visit combatcovid.hhs.gov. If you are eligible, COVID-19 monoclonal antibody therapy can help you get on the road to recovery. When viruses or bacteria infect a person, the body responds by naturally making antibodies to fight them. This includes making antibodies to the coronavirus. Each antibody is specific to the intruder, so people have the ability to make billions of different types of antibodies. These are part of the body's adaptive immune system that helps defend it against recurring viruses and bacteria by learning to recognize and diffuse the intruder during future attacks. However, not all antibodies are equally effective in fighting the infection. While some antibodies can neutralize the intruding virus, not everyone is naturally capable of creating these good antibodies in a fast response time. Scientists have been hard at work identifying effective antibodies to fight the coronavirus. In the lab, scientists produce what is called a monoclonal antibody. The therapies act as a shortcut to help boost the immune system with good antibodies to help fight the coronavirus. They are for sick people with COVID-19. That's different from the vaccine, which is for people without COVID-19. The COVID-19 monoclonal antibody therapy is designed to mimic antibodies found to be highly effective in neutralizing the coronavirus. It's created in the lab, not from using other people's blood, and it's effective for outpatient treatments in one dose delivered intravenously, meaning through your veins. If treated with monoclonal antibodies, a person who tests positive for COVID-19 gets temporary enhanced immunity, which can help them avoid progressing to more severe symptoms. If you've been diagnosed with COVID-19 in the past 10 days and are in a high-risk group, ask your healthcare provider about monoclonal antibodies. Receiving this FDA-authorized therapy requires a one-time visit to a treatment center for an infusion. The treatment is generally well tolerated in patients. A COVID-19 monoclonal antibody therapy can turbocharge your road to recovery, putting you in the driver's seat. Visit combatcovid.hhs.gov.
All right, now we're going to talk about when do you need it, how to get it, and who needs it. Next slide, please. Now, this slide is again to remind you of a website, and in a minute, we're going to give you a telephone number that you can access that will give you information in your specific location where you can access monoclonal antibody therapy, because it's going to be different in different places. Next slide, please. These drugs, there are actually 3 that have been approved and licensed in this country, but only 2 are currently recommended for use because the 3rd one has not been shown to be effective against the Delta variant. And so I'm not going to embarrass myself this week trying to say this name again, but I am going to tell you that for the first drug, it is known by its brand name as REGEN-COV. And the second one, which is only available as an intravenous infusion, is sotrovimab. Not that you need to necessarily remember the names, just remember you're looking into monoclonal antibody therapy. Next slide, please. Now, who needs this? Well, number one, you've got to be 12 years or older and at least 88 pounds. But the most important next requirement is that you have tested positive for COVID-19. So now I know the question will pop into your head. Well, I was vaccinated. Well, yeah, you were vaccinated. We're going to talk in a little bit about why, when you're vaccinated, you may still become COVID positive. But the requirement or the basic necessity for considering monoclonal antibody treatment, you have to have a positive COVID test. You need to have mild or moderate symptoms because the goal of this therapy is to keep you from progressing to significant and serious illness requiring you to be hospitalized. So this treatment is to keep you from having to be hospitalized. Okay? Now, in order for it to work, you need to receive the treatment within the first 10 days of starting the symptoms. If it's after that, the effectiveness is markedly diminished. And then the last thought that you need to keep in mind is, am I at high risk of developing more serious disease after becoming infected with COVID-19? I will tell you that this is one of the most important ways someone who has tested positive, so it's outside the time frame where you could get vaccinated. This is the most important treatment option that we have right now to keep you from progressing to really serious disease. Next slide, please. Now, you want to know who are the candidates? Well, the candidates are, and say it along with me in your head, 12 years or older, positive COVID tests, symptoms within the past 10 days, and you may or may not be subject to developing serious disease due to comorbid or high-risk conditions. If all of that pans out to be true for you, then you want to try to get access or at least explore the possibility of receiving monoclonal antibody treatment. That should be a discussion that you have when you have gone for treatment. If it is not brought up, you need to advocate for yourself and bring it up. The federal government at the present time has bought up the whole supply, so there should be no cost to you for this drug. Depending on where you go, there may be an administration fee. And if you have insurance, they will probably try to bill your insurance. But you should not be charged for these drugs. Next slide. Again, how can I get it? I've tested positive. My symptoms have been within the past 10 days. I go to my healthcare provider and I ask them, am I a candidate? And the next, if they don't refer you, then you need to contact that website or the telephone number that I'm getting ready to give you, and ask them about how you can access it where you live. Next slide, please. Now, what are the common high-risk factors that you want to take into consideration when you have COVID-19? They're the same ones that we've been talking about for the last year and a half. If you're overweight or in the category of obesity, you are at high risk. Pregnancy, chronic kidney disease, diabetes, immunosuppressive diseases. Now, what are some of those? Well, if you have cancer and you're on treatment for cancer, you may likely be on immunosuppressive therapy. If you've had a transplant, you may be on immunosuppressive therapy. But there's some other diseases like lupus that can impact your immune system. If you are on any condition and you have high dose steroids that you're taking, that can impact your immune response. If you have heart or circulatory conditions, these can make you at high risk for serious COVID-19 disease. Chronic lung disease, like chronic obstructive pulmonary disease, or really severe asthma, or some of the other forms of lung diseases. If you have sickle cell disease, that especially if your spleen is no longer functioning, that puts you in the category of having an impaired immune response and at high risk for serious COVID disease. If you have neurodevelopmental disorders such as cerebral palsy, that may put you at significant risk. Or if you have any kind of medical device that can make you at high risk, such as a tracheostomy or a breathing tube in your neck, or a gastrostomy or a feeding tube in your stomach, or if you're on a ventilator, all of these can put you at high risk. Next slide, please. So again, if you want to get information about monoclonal antibody therapy, you can call 1-877-332-6585, or you can look up on Google, Combat COVID, or the website that we shared with you at the beginning of this session. And we will put this number and the website again in the chat so that you can take note of it. So again, why would you want to have monoclonal antibody therapy? Well, because you're positive for COVID, it's within 10 days of your symptoms beginning, and you may be having a comorbid condition that makes you at risk for having serious COVID disease. Serious COVID disease, meaning you have to go in the hospital and you may have need of all of the advanced therapy like ventilators and all of that. So I hope this helps in understanding the possibility that monoclonal antibody treatment provides in case you unfortunately become infected with COVID-19. Okay, I can open it up for questions. Okay, there don't seem to be any questions in the chat at this time about this. We will proceed on now to Dr. Maxey.
Well, thank you. I do have a question for you. Let me know when, first of all, let me know when Dr. Abrams comes on. He should be shortly, but I have a question. What are some of the reasons that people have given, not for the vaccines, but for not wanting monoclonal antibody?
I haven't heard a lot of pushback. The issue has been people aren't aware of the availability of it and what it can do. There's been very little discussion about it. There was discussion back in the winter about Regeneron, which is a component of RegenCov. It's actually a combination of two. And the initial lay press commentary about Regeneron is it's so expensive, it's only for the rich, blah, blah, blah. But that's not true anymore. The government has done, as a result of a number of studies, the efficacy was demonstrated. They bought up the supply and they are making it available to anyone who needs it.
Well,
So Dr. Nabert-Stevens, let me just follow up on what Dr. Maxey said about folks not hearing about the monoclonal antibody. It seems like every time somebody famous gets COVID-19 or gets a positive COVID-19 test, we hear about monoclonal antibodies because they're taking it.
Correct. And so the logical thought from that is that it's only for the rich, or it's costs a lot, so you got to be able to access it. the truth of the matter is it is now available, just like the vaccine is free to everybody. It is available. And now this is my thought on the subject. And I'm basing this on my day job experience, where I look at what kinds of treatment are offered to people when they come to the emergency room. I think perhaps there are a lot of physicians who are not aware that this is available. And it is possible that there may be some remote areas, rural areas, that it may not be as accessible as it is in urban areas. But if we call that number or get on the website, they can tell you how to get it wherever you are.
I have two questions. One, why would somebody prefer to take monoclonal antibody as opposed to getting vaccinated? That's number one. Number two, even though you say that there's no cost, that's to the patient, but there is a cost to getting that infusion. Am I right?
Well, if you're talking about the administration cost, that is usually covered by most forms of insurance. And there are a number, I should say.
I'm not
There are
talking about
a
the
number of
cost to the
public
patient.
health facilities where that would not be the issue, where you can get the administration. To address your first question, that's not an option. Monoclonal antibody is not a choice that you can make between vaccine and getting vaccine and not getting vaccine. Monoclonal antibody only comes into play if you have become infected, which is after the fact, the point of being able to receive the vaccine.
The point I'm saying, there are a lot of people who are anti-vaxxers who are waiting for the monoclonal instead of getting the vaccine in the first place. They'd rather wait and say, I can take monoclonal instead. I don't need the vaccine. That's the point I'm trying to make.
That may be something that people are saying, but the utilization of monoclonal antibody therapy up until now has been not that great. So I would be surprised that many people would be making that choice. I don't think it's that widely known.
Yeah, they're doing that, especially people on the red side of politics are doing that. They say, I'll just take the monoclonal antibody. And when I was speaking about cost, I wasn't speaking about cost to the patient, but it's a high price choice to wait and get the monoclonal, not to you, but to all of us as a whole. But why not get the vaccine and prevent the disease in the first place?
So Dr. Maxey, to your, though we are not a political organization, to your point about people on the red side of politics, everybody that I've heard on TV that's on the red side of politics that is getting monoclonal antibodies has already been vaccinated. So they get vaccinated, and then they tell other people don't get vaccinated. And then when they get sick, they get monoclonal antibodies. So all the things that we are saying folks need to utilize at the appropriate time, like getting vaccinated first, and then if you get sick anyway, getting the monoclonal antibodies, these folks are doing. So I think that whenever I think about that political divide, I think about the fact that there's really some lack of clarity, some would say dishonesty, in how things are reported with this particular issue around vaccination and political stuff. We just need to be very clear that a lot of the people who folks think they're listening to have already been vaccinated. And then when they get sick, they're doing exactly what Dr. Barbara Nabert-Stevens is saying. They're reaching out for the monoclonal antibodies as fast as they can.
And I also want to make sure that we are very clear in the messaging that we give, because there's been so much confusion. The vaccines do not prevent you from becoming infected. The vaccines help prevent you from developing severe disease. And a lot of people are saying, well, there's no reason for me to get the vaccine. It's not working. It's not keeping you from getting the infection. No one who had knowledge of the subject ever said that the vaccine would keep you from getting infected with COVID. What they said was that it will keep you from having serious disease. So I just want to make sure we're clear about that.
So let me jump in and say that I see Dr. Jerry Abraham has been able to join us. Dr. Maxey.
Very good. Dr. Abrahams, we welcome you to the program. Dr. Jerry Abrahams is an academic. He's on the faculty of Drew University, and he has been doing a bang-up job of making sure communities of color in the Southern California area and abroad get vaccinated. He is also a global epidemiologist, and we welcome him and his experience. Dr. Jerry Abrams, we'd love you to speak to us and let us ask you a few questions about what are you doing and where are you today?
Yes, absolutely. As you know, we are here in Los Angeles. Welcome. Thank you again for having me, Dr. Maxey. Dr. Jerry Abraham here, Director of Mrna Vaccines here in South Los Angeles, where we have vaccinated over 300,000 people, protecting our community, keeping our people safe from dying or getting seriously ill from COVID-19. And that's exactly what we're doing today. You can come find us at the Gardena Jazz Festival. We're also here in downtown Los Angeles, where we're vaccinating people as they're going about their day and making sure that we're as protected as we possibly can. As everybody on the call knows, Delta variant's real. People are getting COVID-19, and we're doing everything we can to be safe and protected from getting very seriously sick or dying from COVID. We're offering everybody Johnson and Pfizer and Moderna, their choice. Of course, some vaccines are more efficacious than others. We're seeing with some of the data, but they're all very effective at preventing death due to COVID-19. Latest updates, of course, as of last Friday, we have started providing people their third shot for those that are immunocompromised. As of September 20th, we'll be providing everyone a booster shot 8 months after their last dose. And so we're definitely in the thick of getting everybody vaccinated. Dr. Maxey, do you have any specific questions or other issues you'd like me to address?
Yes. Are you finding more receptivity to getting the vaccine now? And speak a minute about the booster shot. Are people coming forward more now that the Delta threat is here?
Yeah, absolutely. I think we've done an amazing job of getting out into the community and engaging people. Black Health Trust is a great example. The Minority Health Institute, others are engaging, educating people, really providing that confidence in these medicines, in vaccines. And so people are rolling up their sleeve and getting their shot from those earliest days where we had very low numbers turning out. We now have vaccine numbers in the 50, 60, 70% in parts of our community. Still some disparities when we look at Black and brown men, when we look at young invincibles, but there is a mad dash. The lines are back as people go back to school and back to work, as mandates are coming down, as employers and schools are requiring vaccines and testing. We're seeing an increased demand. So it's definitely helping drive up people getting vaccinated. We're also seeing that the incentives help. So everybody's motivated by different things. We've seen some people motivated by these life-saving essential medicines alone, but others motivated by the gift cards the state offers, getting entered into a lottery, getting raffle tickets to prizes. And then, of course, having to get them for work if you work in healthcare or in certain sectors, or because you need them to go to college. All sorts of reasons why people are getting their shot. And yes, people are getting their third shot that are immunocompromised, but I think people are still a little confused. Who can get a third shot? Who needs a booster? So third shots, we believe that people that are immunocompromised may not have ever achieved the optimal protection that others would have received. And so they need a third shot now. Everyone will need a booster shot because the data is showing that there is the effectiveness, the efficacy is waning, is coming down over time. And they saw that with Pfizer with some of the data where there were people that were only 30, 40, 50% protected about 8 months after their second dose. So that's why you're hearing in the news the Biden administration and others saying come September 20th, everyone will need a booster shot about 8 months after their last dose. So that's kind of where we're at. That's kind of the update from the front lines. Still a long way to go. Vaccines, we're going to be here for a second as we look at cough, cold, flu season around the corner. How are we going to get flu shots incorporated into these programs? How are we going to help all the kids catch up? People are behind on vaccines because they didn't go to school in the last year. So we're heavily focused on getting kindergartners, first graders, seventh graders, eighth graders caught up on their childhood vaccine so they can stay enrolled in school. So there is a lot of momentum. We have come a long way. We still have a lot of work to do. So thank you for supporting us. And we look forward to getting more folks vaccinated. Dr. Maxey.
Well, thank you. Dr. Walker, any questions in the chat?
I will, Dr. Neighbor Stevens, if you can look in the chat, I have a question for Dr. Abraham. First of all, Dr. Abraham, thank you for all you do and thank you for being with us. It's exciting to know that you're out there in my old neighborhood doing what you're doing.
Yes.
Here's my question for you. A lot of the incentives and why people say, well, how come they want me to get vaccinated so bad? Tell us a little bit about how people getting vaccinated is helping the rest of us stay protected, is helping us to get past some of the variants and all the other things that are happening because we don't have a lot of us vaccinated as yet.
Absolutely. First and foremost, absolutely want to thank everyone who's playing their part, in addition to wearing masks and social distancing appropriately, washing our hands, everyone that's rolled up their sleeves and gotten their shot. You've really helped us open back up our economy, get back to work, back to school, back to church, back to doing all those things that we love doing, those things that we missed doing the last 15 to 20 months. So that's ultimately all we're trying to do here. We're just trying to get back to all those wonderful things, including hugging and kissing on grandma and keeping everybody safe. But absolutely, unfortunately, what we're seeing is, the data shows 99% plus of people dying in hospitals today are the unvaccinated. 92% plus in hospitals with COVID are unvaccinated. The data, the truth, the facts speak for themselves. Vaccines work, they are effective, they are free, they are safe, and they are our best line of defense when it comes to COVID-19. And it is our best strategy for ending this pandemic. And everyone who is waiting, I ask and I plead, don't do this for yourself. This isn't an act of selfishness. This is an act of loving kindness towards one another, to our families, to our classmates, to our church members, to all those that we come into contact with in our community. Remember the vulnerable that are around us, the grandmas, the cancer patients, those who may not be able to get vaccinated, those who get vaccinated whose bodies will never mount the appropriate response. We're getting vaccinated because together with community immunity, we protect one another. This really is responsibility and accountability to our brothers and sisters. And so that's why I really ask for all those waiting, don't wait for someone to tell you, don't wait for the government to mandate it. Don't wait. FDA approval is coming, I believe, on Monday for Pfizer, for Moderna shortly, Johnson & Johnson right after that. And you can wait, but why wait when we know the facts are there? Hundreds of millions of doses delivered in America, few people with adverse events, the majority being allergies, anaphylaxis to ingredients, to foods or medicines. And those people we know how to treat and manage. We can take care of them in the hospital. The vast majority go on their day. Few have reactogenicity where you may feel a little under the weather. Some people feel a little feverish. Most common side effect is pain or tenderness at the site of infection, and that goes away in a day or two. That's the worst that's going to happen. But the best thing that's going to happen is you're going to have some protection. You're going to have immunity, and we will all be safer for it. So I really hope, don't delay, not a moment to lose, not a drop to waste. Please get vaccinated. Please get your questions answered. As you know, as you've heard me say here on Black Health Trust, we don't take it for granted. Our lived and our shared experiences, the Tuskegee trials, the abuse of Henrietta Lacks cells, the medicalization of racism, the undertreatment of Black pain, all those things are true. But I tell you now, brothers and sisters, this is not an experiment on our people. These are life-saving, essential medicines, and they are there for you. So you proudly roll up your sleeves and you take your shots. And if you're not ready, then that's why we're here. We're here to be your trusted partner, to get your questions answered, to make sure you have confidence, to make sure that you go in there choosing, because this is about your body, your health, your rights, your vaccine, your choice. So thank you so much for your bravery, your courage, because we're all in this together. And when we all get vaccinated, the faster we can get on with everything. And that's all we're trying to do. Thank you so much.
And thank
Dr.
you
Watts.
again. Thank you.
So,
Dr. Watts?
so Dr. Abraham, I did have a chance to look in the chat. Some of us are too old to multitask, but I gave it a shot.
I have faith in you.
Thank you, sir. One of the questions in the chat, you mentioned that you all are able, and praise the Lord, you can do this, give folks a choice between the Moderna, the Pfizer, and the J&J. And so the question in the chat has to do with, if someone has had one vaccine or the other, and they're in a place where they don't have a lot of that same choice, can you get the booster with a different vaccine? Can I had J&J, but I'm getting a booster with Moderna. Can you talk a little bit about that vaccine switching concern?
Sure. And I'll just start by saying, what we're doing today is very much so part of the strategy, and it works. And that strategy is we meet people where they are. We treat people like people. That is the Kedron way. So that means we go to where people live, where they work, where they worship, where they play, where they go to school, and we make sure we go to the homebound. That means we take time to go to the housing developments, to go to factories, to all those places, to churches, mosques, to temples. That's how we get this done. And so, yes, it is hard to take all three vaccines everywhere we go, but that's what we do because we believe in giving people a choice, that they get to choose their vaccines. But we know that choice isn't always available. What we're seeing with the data is that there are studies that show sometimes actually a mix is actually more protective. A mix between a Johnson & Johnson and a Pfizer or Moderna. There may be various reasons and explanations for why we're seeing that data out of Europe, out of the United Kingdom, out of Israel. So absolutely, when your particular vaccine is not available, getting a different vaccine is absolutely recommended. In fact, right now, because of the effectiveness that we're seeing with Pfizer and Moderna, the recommendation is to get an additional dose of an mRNA vaccine if you need a third dose. So again, immunocompromised individual, cancer patient, on chemo, their body is fighting an illness, so they're just not optimal. They're not gonna produce antibodies like others, are taking steroids, they have medicines that suppress their immune system. Those folks need a third shot. And those folks, ideally, you should get a shot of Moderna or Pfizer. That's the recommendation.
What about diabetics?
Absolutely. There are people, as you know, with poorly controlled diabetes, with a really poorly controlled blood pressure that's affecting their heart function. Those individuals are at higher risk. Their bodies may never have mounted the best or optimal response. That's why we're making this recommendation now to get that third shot for these people, because we want them to be safe. I hear all the time, Doc, y'all are saying different things. Every time we come to you, got a different story, different answer. That's not true. The truth is there's more information now. And with that information comes great responsibility to do the right thing. And so if we saw individuals in our community who got a Johnson & Johnson or 2 shots of Pfizer or 2 shots of Moderna, but because they're a cancer patient, they didn't have enough protection, then we knew the right thing to do is to get them that third shot. And so that's why we're now recommending that third shot. That's why we're going to give people boosters come September, because that's the right thing to do to stay protected. But again, what we're seeing, and ultimately very important to hear, all 3 vaccines so good at preventing death, so good at preventing severe illness. And honestly, everybody who gets vaccinated ends up, even with breakthrough cases, they end up with a very mild cough and cold-like symptom, if not absolutely asymptomatic. So that's really what we're going for here, equality and equity when it comes to survivability of COVID-19, and we are there. But those that are not vaccinated haven't achieved that yet. So please don't delay. Let's vaccinate.
So Dr. Abraham, one other point, you mentioned that you're out there helping kids get their other vaccines for school, the ones that kids normally need because people have not been able to get them during the course of the pandemic. What about spacing? Should folks get their, I noticed flu vaccine is now available. Should folks get their COVID vaccine and wait for the flu, or get the flu or wait for their school vaccines? Tell us a little bit about how you're spacing, or if we need to space.
There are differing medical opinions on this issue. There is still not enough data to have a clear consensus. We did see in the earlier days, because there wasn't enough data, out of abundance of caution, we recommended 2 weeks between vaccines. So if you got the flu shot, or if you got the HPV vaccine or any other vaccine, we asked that you wait 2 weeks before getting your second dose. Now it is recommended. There is no reason to delay. As you know, when people come into the primary care doctor's office, we will catch you up, and we do give people multiple vaccines at any given time. Those are things that we're going to want to continue to monitor and watch. However, today we are putting and bundling the flu vaccine and the COVID-19 vaccine together here in Los Angeles County with the Department of Public Health. So they have now sent us a supply of flu vaccines, and we do offer them side by side with COVID-19. With the school-based vaccines, especially because of the laws here in California, where you have to have your vaccines up to date to stay enrolled, particularly focused around kindergartners, first graders, 7th and 8th graders. We're going to look up your immunization registry in the database, and we're going to see what vaccines you're missing, and we're going to go and offer those to you. In addition to anyone over 12 years old, we'll give you your COVID-19 vaccine as well, all at the same time. But we really try to have that conversation with parents who want to do the right thing for their children, for their families. So we totally understand those who want to space them out. There's no clear, definitive answer or authority on this, but we do know that people do give all the vaccines at once and catch everybody up. And we know that there are people who prefer to space them out, and that's okay. And it is our job as your trusted healthcare partner to be patient with you and to give you the information, and then to respect your wishes and do the right thing, because we're all in this together. So we know we ain't trying to do too much or make people uncomfortable. You know, we'll have that conversation with you. I did want to mention, though, come the end of September, probably early October, 5-year-olds to 11-year-olds will be eligible. So we look forward to continuing to take this show on the road. As you know, we've been at middle schools and high schools, and we'll be coming to elementary schools and working with parents and teachers to make sure elementary school children are safe. We have reopened our schools, and we're doing that very safely with the layers of protection that we have, all air filtration systems, the cleaning that we're doing, all of the social distancing, and all the caution that we have. In addition to those being those eligible, getting vaccinated also helps keep our kids safe. So I do want to say I'm really excited that kids are going back, and we're not seeing a lot of transmission between children as we would expect, because children don't have as many ACE receptors as adults do. And that's why overall the data shows transmission between children isn't the same. That doesn't change the fact that Delta variant is highly contagious, so it spreads amongst everybody, but kids in general spread it to each other less than adults to adults and adults to children. So that's a big part of why I want parents listening right now to know it is safe to send your kids to school. We are working very hard to keep kids safe in school. Getting your kids vaccinated for the vaccines that they're eligible for are one of our most effective strategies at keeping children safe and protected. These are preventable infectious diseases. Just remember, smallpox eradicated. We don't see polio in this country anymore. Chickenpox, a rare event. Measles, mumps, rubella, HPV prevents cervical cancer. So vaccines work, and I hope people think that the same way they think about COVID-19 vaccines. And people ask me about the quality and the makeup, the ingredients. I also remind people, I thank them for asking those questions. Keep asking those questions. Keep asking those questions about your clean air and your clean water, what's in your food. You need to be engaged. Your body, your health, and I applaud you for it. And these vaccines are safe, effective, and free. And you keep asking those questions and ask them about everything else you're coming into contact with every day as well.
Well, thank you so much. I know you got a lot of work to do. You're welcome to come back and stay if you want, but I know you're saving lives. We thank you for all the work that you do.
I really appreciate that. And I just want to tell people, we're all in this together and we will get through this. And we're, many of us are people of faith as well. We will pray. We will get through this. Let's help each other. Now is not the time to divide one another. We are, we're seeing that. We're hearing different information from different people, but let's find trusted sources. The Black Health Trust, a trusted source for information, for medical information for our people. Keep doing what we're doing. Yes, eat right. Let's move. Let us sleep well. Let us reduce stress. Let us reduce depression and anxiety. All those things help, but they do not prevent COVID-19. So vaccines work, and vaccines are an important part of the strategy, in addition to everything else we can do to keep ourselves and our community safe and healthy. Thank you so much.
Thank you so much, Dr. Abraham. Dr. Abraham, before you leave, can I just toss in one other question that was in the chat? Because we are all looking for good information. And the question in the chat was whether vaccinated people can spread the virus more easily than unvaccinated people. And folks are asking these questions, and someone like you that's out there in the field answering those kinds of questions, just hit that one for us. This concern that when I'm vaccinated, we know folks can get infected when they're vaccinated. The question is, are they spreading the virus more than the unvaccinated people are spreading the virus?
Absolutely not. So people that are vaccinated are definitely getting COVID less than others, and they are spreading COVID less than others. The vast majority of COVID being transmitted right now are amongst the unvaccinated, as goes for hospitalizations and severe illness and death. But yes, as we expected, just like we are creating layers of protection to protect people against COVID-19, the virus is doing what it does, which is creating mutations, variants, strains. And so we knew that day would come. And unfortunately, the Delta virus came, and it is more contagious, and it will spread, and it spreads between people faster and more than other strains, including amongst vaccinated people. However, the vast majority of transmission, the vast majority of COVID-19 infection right now is amongst the unvaccinated. We will continue to monitor the breakthrough cases. And of course, we are looking to continue to prepare if there are more virulent, that means more severe, more deadly strains that emerge, more contagious strains, we'll be prepared. And if we have to, we will continue to improve our vaccines so we continue to maintain protection. But those that are vaccinated don't spread COVID-19 more than others. And the vast majority of people with COVID-19 right now are the unvaccinated. I really hope everyone here, vaccines work, vaccines save lives. They prevent people from dying and getting severely ill from COVID-19. I hope that alone encourages anyone waiting to go get vaccinated.
Thank you, Dr. Abraham. Thank you so much.
We'll see you soon, live from LA.
Stay safe. Bye-bye.
Okay, bye-bye.
That was such a good question, Dr. Waltz. That was great. That cleared up an awful lot of things.
Well, Dr. Maxey, I think one of the things that we try to do on the Black Health Trust with your leadership is to give voice to those questions. All questions are reasonable questions. And I think having Dr. Abraham, who's out there doing that work, be able to address a question like that, it just makes sense. So yes, I'm glad he was able to address that question.
Good. I'd like to discuss a few things about the virus and the vaccines, and also the idea behind booster shots, and see if there are any questions about that. Simon, can you go to the next slide in your deck? We're going to talk a minute about the mRNA vaccines, that there have been a lot of questions about them. Go to the next slide, please. So we know that messenger RNA, go to the next slide, please. Messenger RNA is taken up by certain cells. They're called dendritic cells in the body. This stimulates both cellular and humoral immunity. This is via the T cells and the B cells, and this is how the immunity starts. The messenger RNA is a genetic material that tells your body how to make proteins. Let's go to the next slide. So the vaccine is made of mRNA that's wrapped in a coating of lipid, that's fat, that makes delivery easy and keeps the body from damaging that very delicate antigen that we want to react to. The mRNA vaccine teaches your cells how to make copies of the spike protein. So this is like 3D printing. There is no actual virus or no actual virus material in the mRNA vaccines. So later, if you're exposed to the real virus, your body will already have instructions in memory on how to fight it. Go to the next slide, please. The vaccine does not contain any virus. I want to emphasize that. You cannot get COVID from the vaccine. When your body receives the vaccine, it can sometimes cause a fever, headaches, chills, side effects, but those are usually very temporary. I had my booster shot actually 2 days ago. I had no symptoms. The shot didn't even hurt. My wife did get a little bit sick overnight, but she's now doing fine. So all of this is normal and standard in vaccines. It shows you that the vaccine is working. After the RNA delivers instructions to your cells, your body breaks down the vaccine and gets rid of it. Let's go to the next slide. An mRNA vaccine is one of those uses of copies that the molecule is messenger RNA, and this is what produces the immune response. Let's go to the next slide. So the next question is, why are booster shots needed? And a number of experts, go to the next slide. A number of experts point to the longer period, a longer interval between doses that provides a more robust immunity. Faculty at Baylor University say that the 3-week interval between doses of Pfizer's RNA and the Moderna may not have been enough to spur an extended immunity. So your body may need that time to build up a good quality response. This new 8-month period is long enough to allow your initial vaccinations to give you potentially a good immunity, and now the yield of high level of good quality virus antibody is able to build up with the vaccine. Let's go to the next slide. So it's typical for antibodies to wane or get lower over time. And therefore, it's common for vaccines to be administered in multiple doses over a longer period of time. People get 3 shots over a 6-month period for hepatitis B. So in a multi-dose vaccine regimen with longer intervals between doses may give them a better immune system response. It allows the antibodies time to mature. During this time, this process is called affinity maturation. And this allows the body to create a better quality of antibody. That is why you need a booster shot. So a third vaccine dose, let's go after the next one. Next slide. May promote this process, but we're thinking that possibly after this booster, you may not need it anymore. But I emphasize, as Dr. Abrams said, we're learning new things every day, every week, and every month. And right now, there's not full data on what the future really holds. Let's see if there are any questions about anything that any of our speakers have said so far.
There was one question in the chat earlier, Dr. Maxey, and it reads, my friend had a negative rapid COVID test yesterday. They were in close contact with a COVID positive couple in the last 5 days. The clinic told them not to worry about a repeat test. And it's asking for our thoughts on the clinic telling, I'm assuming the question is, what is our response to the clinic telling them not to worry about a repeat test? My first concern would be, and then I'll toss this over to you and Dr. Nabret-Stevens, is I'm wondering if the friend who had the negative COVID test is vaccinated, because that I think would color some part of the response. So I wanted to get that question out.
Well, my first thing would be to any health professional who tells a patient without examination, history taken, et cetera, don't worry. That's scary right there. You need to know what you're talking about. You need to have known more history than you're likely to get at a testing center. And we do know that in these tests, there are false positives. We know there are false negatives. So I would simply say, if you have been exposed, you should be tested again, maybe not the next day, but certainly within a week or two, and find out your status. But you should be protecting yourself with masks, with social distancing. And I think you did answer the critical question. We'd like to know, was that person previously vaccinated or not? Because that would be very important in that. Dr. Nabret, any comments?
Well, I think this is a good real life scenario to learn from. We have been saying for the last several weeks that if you're vaccinated, you still need to wear your mask, because you don't know, even if the people around you are vaccinated, you don't know, and they don't know if they might be at that moment infected. So that is why the recommendation has been made that you need to wear a mask, even if you're vaccinated. Now, as far as whether or not in this scenario, they were vaccinated, they've had a negative test, my suggestion to them would be to be watchful and to monitor themselves for at least another 5 days. Once they get outside a 10-day window, you can argue 12 days, 14 days. But once you get past 10 to 12 days and there are no symptoms, you can probably be more comfortable in thinking that you've passed this problem, except vaccinated people and unvaccinated people can be infected and not have symptoms. So you still don't get away from wearing a mask.
Very, very good. Are there any questions for us?
So one of to stay with Dr. Nabret's theme of real life scenarios, and to pull in your theme, Dr. Maxey, about common sense. So what does the COVID-19 vaccine booster actually mean for us? So let's say, Dr. Maxey, you said you went out and you got your booster. Are you going to be inviting us all over for a nice party in the family room and hanging out with a bunch of people? What does it mean to say, well, I got fully vaccinated or I got my booster? How does that practically impact what we do?
Well, it does give you more security. It does give you a better down the line response of your antibodies, and it makes them potentially a better quality and more robust. But I still use the word common sense. We do not know how infectious, how transmissible this Delta virus is. So I continue to wear my mask around people. I'm still practicing. I don't let people get in my face. I require anybody coming in my office, we spray their hands. We ask questions about it and they must wear a mask. And I encourage them all to become vaccinated. So I will invite you to my house, to my backyard, and we can have chicken and fish. Barbara will bring us some meatloaf and we can do that. But inside the house, we still will socially distance. Now, my wife won't let anybody in the house that she doesn't know. So she's going to be very protective. The other reason we wanted to get protected, we have a new grandchild about to come, and not only do we have to be completely vaccinated, but Barbara, there's something called a Tdap or that.
Absolutely.
Yeah, so we got to have all that. My daughter will not let her grandparents in her house if we don't have everything we're supposed to have.
Please say what that's all about. That's about pertussis.
Yeah,
and there was a
it.
commercial out a while back of a grandmother who had a wolf's head. Yes, the just because you are a seasoned person, or some people will go ahead and call themselves seniors, does not mean that you don't carry pertussis. In fact, that's a known reservoir of pertussis or whooping cough. That's the lay name, whooping cough. So yes, we're very cautious about newborns being around their grandparents unless they have had their vaccination for whooping cough updated.
In fact, we ought to have one of our programs on etiquette for grandparents. There seems to be a lot of grandparents on this call. So we got to protect our youngsters. I have an idea. I do practice medicine every day, and I read an article a few days ago that talked about some patient experiences with what I'm going to call bad doctors. That doctors nowadays are often not well paid, and many doctors also want to sell a lot of snake oil in their offices. And this gentleman gave several examples of patient experiences. So a guy went into the office and said, well, doctors, I've had some itching, on my back. And he started to pull up his shirt and to him said, I don't need to see it. You need to go to a dermatologist. The patient then said, well, I've also been having a few headaches. What do you think? Well, I think you need to go to a neurologist. And then he said, well, I've been a little bit dizzy. The doctor said, well, I've got some potion here that will fix everything that's on with you. Let me write that, and you go on to these doctors. He never touched him, never addressed his symptoms, never examined him. And I want to make sure that people on this call, we see real doctors who will follow up your complaints, not only with compassion, but with some ability to track down the history, the symptoms, do a physical exam, palpate when necessary, and not just make snap judgments. No matter how long you've been practicing medicine, it does require some diagnostic thought, some probability with the patient to know what has to be done. It doesn't always take a full physical exam, but it does mean you need to talk, get the history, and do some type of palpation. What are your thoughts on that, doctors?
Dr. Maxey, I remember being a resident on rounds, and you always wanted to get the first question because the answer to the first question was always take a good history. And I think it's important that we spend time to find out what people are really coming to see us about. And it's not always the thing that's on the form they fill out or on the message that they leave or what they tell the staff. So there's something about connecting with someone so that they can actually tell you what's going on that matters. It's tough sometimes. I recognize that in whatever job we have, we're busy and sometimes we are rushing, but I think we have to be willing as providers of whatever service we provide to make sure we understand what the person, what the customer, what the patient, what the person in front of us is asking us to do. So I would encourage people, if your doctor is not able to listen to you and you're not able to connect with that doctor, it's time for another one.
Yeah.
You said it nicer than I was going to say. I was just going to say fire them.
Well, yeah.
But you know me.
Yeah.
Well, so let me ask a different question, Dr. Maxey. We've talked a lot today about vaccinations. We've talked a lot today about health and about safety, and I learned a new word, Tdap. I'm gonna have to figure out how to make sure I have access to nieces, nephews, grandkids, whoever I want to stay in contact with. We're looking at a global problem with respect to the coronavirus, with respect to COVID-19. We're looking at all of these folks who are not vaccinated around the world. And I think it was pretty clear today that by a lot of folks not getting vaccinated, it's not a personal choice. It is, but it really impacts everybody else because the virus has more time to mutate. And so what about Lambda? What about all these other Greek letters that are coming down the road? What are our thoughts about that? And how concerned should people? Well, we got Delta. Delta's as bad as it's going to get. Why should I worry about something else? How concerned should we be? I'm gonna throw this to you, Dr. Maxey, about the potential other things that are coming down the road.
I think we should have concern. I don't think we should necessarily be afraid. That's not what I'm saying, but we should always be watchful and concerned. The nature of a virus or any organism is to survive and propagate. So once you create a vaccine or an antibiotic against an organism, it's going to select out those things that may be stronger than that. That's why you want to get to a larger degree of immunity to stop that from happening, or at least decrease it from happening. There's a friend of ours who's on our medical advisory board who spoke about the lack of adequate vaccines being available in places like Jamaica. And I'm sure they're having a problem in Haiti. And I spoke with Dr. Abrams when I got my vaccine the other day, that every day they have to throw away vaccines that have become outdated. So we could definitely be doing a better job getting some of these vaccines to the Caribbean, to Africa. I know that the president has promised to give over 200 million doses to other countries, but we're not doing, in my opinion, a very good job of getting these vaccines there. So we know that there are different variants that are going to pop up by nature of being treated. That's what's going to happen. That's why more of us need to be vaccinated. But you bring up the question to me, Dr. Walks. I'm so concerned that our people feel insecure about being treated, and we think there's something special about the vaccine that we have to question it, but we don't question those blue pills we take. We don't question the food that we get from the grocery store in Beverly Hills. We only question the vaccine, which clearly has the ability to help and save lives. We need to provide even more information on health disparities, on disease processes. We're not trying to take people to medical school, but the more you know, the better off you are. So we need to go back to one-on-one health, public health, and teach people how to eat right, how to live right, whatever that means, because it's not just this virus that can take us out. And I know that many of us are concerned about how much it costs to buy health insurance and life insurance. And I know that those people who own those companies are looking for ways to make your rates go up. And people who smoke, the rates are going to be up, and they can do that legitimately. Right now, Obama's bill prevented them from doing it for health reasons, for pre-existing conditions. But what if somebody says, if you don't get vaccinated, you bear the cost of your hospitalization on your own? Now, the slippery slope there is, what if they say, if you're 400 pounds and have a heart attack, you have to pay for that. If you have diabetes not being treated, you have to pay for that. So we need to know more about how to manage our own health. It's not only COVID, but this is the beginning of companies looking for ways to outlaw you from getting the treatments and the coverage that you deserve. But we have to look out for ourselves. I'd like some questions around that or discussion around that. And I know I saw one of my mentors on the phone, Dr. Richard Williams, if he could be opened up, if he's still on, or Dr. Neighbor-Stevens, if you have any comments as well.
Well, I do have a comment while they're opening him up, because I was going to bring this up anyway. Now, clearly, we're in a crisis with COVID, and there are a lot of things that impact, not the least of which is fear of going to the doctor or to the hospital because of the level of virus that's in the community. But I can tell you again, from my experience in my day job, that we're seeing more and more people presenting with late stage cancer, with diabetes that has not been managed because they haven't been in to see anybody, hypertension that has not been managed. We at the symposium heard firsthand study information from the hospitals in Brooklyn. And I have seen since then articles stating this in other places as well. People have not gone to the hospital when they've had heart attacks. They have not gone to the hospital when they've had strokes out of fear. We are going to have to come to a way of managing our lives in the times of COVID. And just because COVID is here does not mean that breast cancer is going to stop happening. Women are going to have to continue getting their mammograms. Women are going to have to continue getting their pap smears. People who are of the right age need to continue getting their colon screenings. We cannot forget all of the preventive tests that we've known about for years that need to be done just because we're in a crisis period. We've been in this crisis now over a year and a half, and the suggestions by the experts is that we will be in this situation for not months to come, but actually years to come, partially because of what you were just addressing, Dr. Walks, the issue of only 10% vaccination rate worldwide, so that the virus will have the opportunity to continue to mutate. So, but I want to emphasize to everyone, don't forget to take care of yourselves in the ways that we've known for years how to do.
Well, I think those are very, very important points. Did they find Dr. Williams?
Dr. Williams was on earlier, and as with many of us, he may have lost the internet battle. Sometimes we win, and sometimes the computers win. But I do not see him at this point.
Okay. Well, we're approaching the top of the hour. I want to give a chance for any questions that may be in the chat box to address them before we start to close this out.
I think one comment, Dr. Maxey, Dr. Lisa Kerwin-Dawes mentioned that some companies in Jamaica are looking at not letting folks have all the benefits like paid leave when they have COVID. And I think it may be interesting to have her make a comment about how things are going in Jamaica, given Dr. Neighbor-Stevens' last comment about the lack of folks being vaccinated in many other parts of the world. And just one other point I want to make, when I think about what may be happening in Jamaica and other places, I read a very heart-wrenching story about the folks that make all of these tests, throwing away millions of tests because they thought that we were out of COVID, and all of the countries that don't have testing materials. It just hurt my heart to read about all of the waste that happens because we think so insularly about, well, what's happening in my neighborhood or in my country, when we live in a world that's broader than that. Dr. Kerwin-Dawes?
Thanks. Thanks for listening. But presently in Jamaica, we're going through our third wave. And it is with the Delta. All our ICUs are full. All our COVID wards are full. Even our tents are full. Some of the employers now, because they're already under financial issues, have issued that if their employees are not vaccinated and they get COVID, they are not going to pay for their leave, which is interesting since we don't have adequate vaccines. We just got in some Pfizer vaccines, which they're using for the children to help to get them back in school, 12 and up. But this is going, a lot of the and I know some of the employers who have now come up with that, saying they're not going to pay for it. It's already expensive, and they're not going to pay for the extra, for the leave. It would be interesting if we could actually get, and I think it's difficult even using COVAX. I think Jamaica is so close to the US, it would be nice if some of their vaccines that will soon be expire, if we could give it directly to Jamaica. Because going through COVAX and the timing, it takes them a while, which gets it even closer. Mexico gave them some AstraZeneca, and they actually got, I think, don't quote me to be exact, but I think it was 80,000 doses were given out in 2 days. Came in and just, they were out. So,
Wow.
but that is going on now. We are full, we are on lockdown again. And that's because, well, there's several things. We opened up last month to have a series of parties on the North Coast called Dream Weekend and a couple of others, usually sponsored by North American Jamaicans or North American investors with US money coming in. They required antigen testing to enter the parties, but when you look at the pictures, and I can share that with you later, nobody was wearing a mask. And what we heard later is that fake antigen tests were being sold. So you could even get the test faked to come in. So it's bad here right now. And employers are already doing that.
Well,
Wow.
Dr. Lisa, we will keep you in prayer. As you know, I have family in Jamaica. I love Jamaica. I think we also have to be aware of what's happening on top of what's happening in many parts of the world. In particular, Haiti comes to mind. Our brothers and sisters in Haiti who continue to struggle from one challenge to another. I just think it's important for us to think broadly, to understand that there are people suffering right in our communities in America, across the country, and many other places as well. So our hearts and prayers are with you.
We need it because Grace came to Jamaica. Henry didn't need it like it's hitting you guys, but we had a lot of flooding. Some people still haven't gotten back electricity.
Wow.
Well, thank you, Dr. Lisa. We need to talk. Dr. Salafu wanted to talk to you about what we can do about giving some vaccine help and program help to Jamaica. So we need to be on top of that as soon as we can.
I could use all the help. We can use all the help.
Amen.
Well, thank you.
Thank you.
So if there are no more questions in the chat or nobody raising their hand, and I don't think Ms. Ager or Pastor Pointer on today.
Yes, yes, she's on.
Okay, so then after we invite Ms. Brenda Lee Ager to close us out, I'm going to ask the healthcare leader of a certain church congregation in Maryland, who's also a psychiatrist, to fulfill the final role of taking us out.
Hold on, Dr. Maxey. I will do anything to postpone me being raised as anything other than Ivan. I see my dear friend and my psychiatrist, Ron Bailey, on, and I'd like to ask Dr. Bailey to make a couple of comments if we can get Ron Bailey unmuted, and that'll postpone whatever Dr. Maxey wants me to do.
I appreciate it.
Ron.
I appreciate it. I'll be very brief. As usual, cannot thank you guys enough for including me. Dr. Maxey, Ivan, Barbara, all of you. This just gets better and better. I learn something every single Sunday. I just simply wouldn't miss the opportunity to say how proud I am of hearing the great comments about the outstanding hospital, Kedron Hospital in Los Angeles, where I was fortunate to work for the last 2 years, and by our outstanding young man, Jerry Abraham, just as outstanding as he can be. All the comments that were discussed were timely. Abraham has led Kedron Vaccines, I think, to high heights with high quality work, a knowledgeable reference frame point, and staying there till 6 and 7 and 9 o'clock most every night, burning midnight oil. We all are very proud of him. I think our entire community nationally should be very much aware. This is what you certainly can do when you put the quality care of African Americans and persons who very often have been historically marginalized at the top of your list of agendas. So thank you, Dr. Maxey, and your group for giving Abraham an opportunity to kind of discuss what's going on at Kedron. And I really appreciate, I think, the concept that we really have moved beyond just this idea that is about hesitancy and those type things. It's really about, as Barbara said, a comprehensive approach to all aspects of healthcare, I think, in our community that I think was addressed today. Really appreciate it. Thank you very much.
One other thing, Dr. Bailey, before you leave, you received an appointment from a very prominent fraternity recently. Would you tell us about that, and how is that going to affect our health situation in America?
Yes, in fact, I should mention that piece. I'm sorry if I forgot. The fraternity Alpha Phi Alpha, as Randall Maxey mentions, put together by our national president, Lanzer, in Chicago, a really outstanding idea, the idea of a healthcare initiative that's internally based by members, for members, focusing on African-American men's health. Now, it says all of that, but of course, it's going to be external. We're having some activities already that I think many are watching on, we have a YouTube channel. My group, I'll be the deputy director or deputy surgeon general's call for mental health and violence prevention issues that I hope to be able to bring to this show one day going forward. Our leader is Jeff Sterling. Sterling is in Fort Worth, based out of Chicago as well. Initially, he's the Surgeon General for internal health within the fraternity. And I just simply say that for so many organizations, there's often a medical director who their engagement is actually external. They're a mouthpiece for what others know and think about their organization. This piece that's focused internally on the healthcare African males, I think, is something that's well needed in my fraternity and others. So thanks for me a chance to talk about it. We have a year-long program where every week there's going to be a different webinar by members discussing concerns regarding African men's health. I think really tied well to what we've done in the NMA over the years. So thanks so much.
And what's the name of that great fraternity? I want to recruit Dr. Walks to it.
I'm sorry, I think that is called Alpha Phi Alpha Fraternity Incorporated.
Well, thank you so much, Dr. Bailey.
You too. As always, wonderful show today.
Oh, good. Are there any final words, Dr. Nabrit and Dr. Walks?
Be on guard. Be careful.
Dr.
Amen.
Walks?
I will follow up after Miss Ager, because she always inspires me. So I will try to do as you asked, Dr. Maxey. Miss Ager, please.
I just want to say I love you guys, all of you doctors. Beautiful, beautiful inspiration to all of us that are getting the information that we need. So, I believe, I believe, I do believe. People get ready. There's a change coming. Don't need no baggage. You just get on board. All you need is faith and a little information. Don't need no baggage. You just thank the Lord. Don't need no baggage. You just thank the Lord.
Amen.
Thank you.
Amen. Amen. And as usual, Miss Ager, you have inspired me. Thank you. Thank you so much. We talk a lot about being people of faith. We talk a lot about love. And I think it's important for us to recognize that love is an action word, it's a verb, and it really requires us to do something. I'm inspired also by what Dr. Bailey shared with us about Alpha Phi Alpha and what they're doing. And I think all of us are connected somewhere. I'm connected, very, very much connected to my church and to other places where I volunteer and I spend my time. And I think that the opportunity is there if we do have that faith. There's a scripture that talks about, if you don't know love, you don't know God, because God is love. I'm paraphrasing, of course, but it's there. And I think it's important for us when I hear the challenge and the concern in Dr. Lisa Corwin-Dawes for her people in Jamaica, and the opportunity for us to care and do something in different areas, including Los Angeles, Detroit, other places. I just think that our chance to show God in action is a wonderful thing for us to be able to take advantage of, grab a hold of it and embrace it, the opportunity to make our lives impact others. So that's what I have, Dr. Maxey. And I just want to say thank you all so much for what we do every Sunday. It's a wonderful time to spend. God bless you.
Thank you so much. I'm going to add the title, Reverend Dr. Walks. We appreciate that. Thanks,
My
everybody.
father was Reverend Walks, by the way. So
Okay, I'd like to thank all of our participants, our guest speakers, our co-moderators, Dr. Walks, Dr. Neighbor Stevens, our virtual assistant, Ms. Yakini Stevens, our person and technician who handles our production, Mr. Simon Cooper. Thanks, everybody. Have a great, great rest of your weekend.